Good morning, my name is Teresa and I'm going to be your nurse today, and I'm here to do a physical examination. Is that okay?
Yes.
Okay, hand hygiene, washing my hands. I'd like to check your ID bracelet, please.
Sure.
What is your full name, please?
Samantha Bukhari,
Okay, and your date of birth?
0102-1994.
Great, thank you, Ms. Fakuri. And Ms. Fakuri, why are you here?
I am here to practice my final practice.
And where are we at?
We're at Marine Valley Community College.
And what month is this?
May.
Okay, so by asking my patient all these questions, I'm assessing her level of consciousness, her alertness and orientation. So my patient is alerted to person, place, time, and situation. My patient appears her stated age. Her behavior is appropriate. She is cooperative, and she's able to follow commands. And her facial expression is relaxed, and I do not see any evidence of any acute distress. Her speech is appropriate, it's clear, and the tone of voice is normal, and she stays on topic. In terms of grooming, she looks recently showered. Her hair is nicely combed. Her teeth are brushed, and her nails are nice and clean and groomed. And I assessed that when I was checking her ID bracelet. So I'm looking at my patient, and she's normal cephalic, and her facial features are symmetrical. I am gonna palpate your scalp a little bit, and please tell me if you feel any pain. No tenderness, no pain?
No.
And I do not feel any lumps or bumps. I'm also gonna check her hair and scalp. So I'm now just gonna separate her hair by 1 inch, inch by inch, and I'm looking at the scalp. I do not see any ecchymosis, no bruising, no bleeding, no scarring, and no parasites or of any kind. And her hair is abundant, it's evenly distributed, and it's nice and coarse. And facial features are symmetrical. She's normal cephalic, I already stated that. And also her neck is symmetrical. The position of trachea and sternal notch is midline, as it should be. The skin on her face looks normal. She's not cyanotic or anything. The skin tone is even and is appropriate to her ethnic background. I do not see any scarring. I do not see any moles, any birthmarks, any visible lumps or bumps or any bruising, anything abnormal like that. And I'm gonna look at her eyes. The position of the eyes is symmetrical. They're equal in size. The eyebrows are present, eyelashes are present. I'm looking at the sclera, it's nice and white. And I'm gonna look up for me, please. I'm gonna look at her conjunctiva. It's nice and pink and moist, as it should be. The lacrimal gland is without any discharge. I do not see any lid lag or ptosis. So now I'm gonna assess your pupils. I'm gonna shine a light in your eyes. So I'm assessing Perla, and her pupils are equal, are round. They do react to light, and I will check for accommodation now. So can you please follow my pen light? Do not move your head, just follow my pen light with your eyes only. So I see that her pupils do accommodate. Keep following my pen light, please. Okay, and movement of her eyes is normal. I'm gonna check your ears now. Can you look to your left, please? And I'm gonna check the auricle and the labule, and the skin looks normal. There's no redness, there's no ecchymosis. I'm gonna depress the tragus. Do you feel any pain?
No.
So no pain. And the ear canal looks nice and clear. I do not see any discharge, so this is normal. I'm gonna check the other ear now, and I'm gonna look for the same things. So there's no redness on the auricle or on the labule. I'm gonna depress the tragus. Any pain? No? No, okay. I'm gonna look in the ear canal. No discharge, so everything looks normal. I'm gonna also assess my patient's auditory acuity to verbal and whispered word. So I already know her auditory acuity to verbal word is good because when I asked her all these questions, she was able to hear me and understand me and answer back. So now I'm gonna stand 2 feet behind her. I'm gonna whisper a word. And Ms. Fakuri, can you please tell me what I whispered? Apple.
Apple.
Okay, great. So next I'm gonna check your nose. So I'm gonna look with my pen light and I'm gonna check the mucosa in the nose. Looks nice and pink and clear. I do not see any polyps, anything abnormal. The septum looks midline and it's not deviated. I do not see any flaring. And I'm gonna also check the patency. So I'm gonna occlude one of the nostrils and ask you to breathe through the other nostril, please. Can you breathe through the left nostril? I'm breathing okay, right?
Mm-hmm.
And the other nostril? Breathing okay?
Mm-hmm.
So patency is good. So now I'm gonna check your mouth. Open your mouth for me, please. And I'm gonna check the oral mucosa, the sublingual mucosa. Everything looks nice and pink and clear. I'm gonna check the hard and the soft palate. The uvula is midline. The gums are nice and pink. I do not see any bleeding. The teeth are nice and straight. There are a couple of fillings, but I do not see any like loose teeth or anything like that. All teeth are natural. Patient is not wearing any dentures. Her lips are nice and moist and pink. I do not see any scaling, any cracking, or any bleeding. So now I'm gonna ask you to perform a couple of range of motion exercises on your neck, please. So can you please look down for me like that and bring your head up? That's the flexion and extension of the neck. Any pain?
No.
No. Look to the left, please, and rotate your head to the right, please. Any pain?
No.
No? Okay, great. Now, I'm gonna place my hand on your left cheek and ask you to turn your head to the left, please. Now turn your head to the right, please. Okay, so I see that patient is perfectly able to turn her head to the left and to the right against my resistance. So that means that I see that the strength in her neck is pretty good. Now the shoulders look even. I'm gonna press down on your shoulders now. Shrug your shoulders for me. Okay, she's got pretty good strength in her shoulders as well. I am gonna also palpate your sinuses. Any pain?
No.
So these are the frontal sinuses, maxillary sinuses. Please tell me if you feel any pain. No pain? Okay, that's good. Carotid pulses. I'm gonna palpate your carotid pulses one at a time. Right carotid pulse. Left carotid pulse. So I'm checking for rhythm, rate, and force. And the carotid pulses are equal bilaterally. The rhythm is normal, and the rate is 2+, which is normal. Now I'm gonna palpate your lymph nodes. I'm gonna start with the pre-auricular, post-auricular, occipital, back of your head, that would be occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. So I do not feel any enlarged lymph nodes, which is good. Any enlarged lymph nodes could indicate like infection or something abnormal. So now I'm gonna move on to respiratory/cardio assessment. And first I'm gonna assess my patient's mode of breathing. So she's breathing through her nose. She's breathing pretty easily. And she's breathing pretty easily in supine position, in prone position, and in an upright position. She's not using any accessory muscles. There is no retractions present. There is no cough present or sputum. the chest looks symmetrical. The overall shape of the chest is normal. The anterior part is twice as wide as the lateral part, which is as it should be, which is normal. The skin on her chest looks normal. It's appropriate to, that skin tone is appropriate to her ethnic background. I do not see any lumps, visible bumps, or any ecchymosis, any scarring, or birthmarks. And the skin turgor, I'm gonna pinch your skin. The skin turgor is good. I do not see any tenting. And I palpate your chest now. So I'm checking for any lumps or bumps. Please tell me if you feel any pain. Any tenderness?
No.
Any pain?
No.
Okay, and I would also palpate for crepitus, check for crepitus. There's no crepitus present. I would also palpate the lateral parts of her chest and also the posterior part of her chest. I would next palpate the 5 cardiac landmarks. I would start with locating the aortic region, which is, we have to locate the sternal notch. This is the angle of Louis, second rib, right side of the chest. So this is the second intercostal space. This is the sternum. Right by the sternal notch is where the aortic region is, and I'm palpating for any lifts or heaves. There isn't any. Pulmonic region is second intercostal space, right by the sternal notch, but left side of the chest. No heaves or lifts present. Erb's point is third intercostal space, left side of the chest, right next to sternal border. Tricuspid, I'm sorry, that would be fourth intercostal space, right by the sternal border. And finally, mitral area, that would be the fifth intercostal space, but mid-clavicular line. And I do not feel any heaves or lifts. So now I would assess the extremities, both upper and lower extremities. I would look at the skin. So skin appears nice and warm. It's not hot and it's not cold, which indicates good perfusion. Okay, and skin looks nice and clear, no bruising present, no ecchymosis, no scars, no lesions. I would also note the presence of hair. If there was no hair present, that could indicate arterial insufficiency. I would then go ahead and palpate the extremities. I'm palpating for any lumps or bumps or presence of any edema. I do not note any edema present. I'm gonna depress against your tibia. There is no dimpling, so there's no edema present. So my patient does not have an edema, but if she did, I would rate that on a 3 scale, +1, +2, +3. I would also look at her nails. Her nails look nice and pink. There's no cyanosis, no clubbing. I would look at her toenails. So, I'm sorry.
No, it's okay.
I feel stuck. So toenails look also nice and pink. I'm gonna check capillary refill. So it's brisk and it's less than 3 seconds in her toes, which is normal. Put your sock back on. And in your fingers, it's also nice and brisk and it's less than 3 seconds, which is normal. And next I would check all the peripheral pulses. I'm gonna start with the radial pulses, and I would check them simultaneously in both arms. I'm checking for rhythm and force. And they are equal in both extremities. The amplitude is 2+, and they are normal in rhythm. The rhythm is normal. I would check the femoral pulses, looking for assessing the same things. The popliteal pulses, which are behind the knees. The posterior tibial pulses, and also dorsalis pedis pulses, which are on top of the feet. And again, I'm assessing rate, rhythm, and force. So all the pulses are equal bilaterally. They're 2+ in force, and the rhythm is normal. Next, I'm gonna move on to auscultation. I'm gonna take my stethoscope. So I already identified the 5 cardiac landmarks. Now I'm gonna go ahead and auscultate the 5 cardiac landmarks, starting with the aortic, second intercostal space, right side of the chest, right next to the sternal border, pulmonic region, second intercostal space, left side of the chest by sternal border, Erb's point, third intercostal space, left side of the chest by the sternal border, tricuspid, fourth intercostal space, left side of the chest, right next to sternal border, and finally mitral area right here, mid-clavicular line, fifth intercostal space, left side of the chest. And what I'm listening for are solid S1 and S2 cardiac sounds. Should I hear any extra sounds such as murmurs or S3 or S4 sounds, that would be abnormal and could indicate pathology. Next, I'm gonna auscultate your lungs. So I would like to listen to all 5 lobes. There are 2 lobes on the left side and in the left lung, and right lobes in the right lung. So I am gonna ask you to take a deep breath every time you feel my stethoscope, please. And I'm gonna start with the area above the clavicles, and I'm gonna use the ladder pattern for this. Take a deep breath, please. In and out. Deep breath, please. In and out. And at each point, I'm gonna listen for 1 full respiration, 1 full inspiration, and 1 full respiration. Ladder pattern, full respiration, full expiration, full inspiration, full expiration, and finally the lateral part. I'm gonna listen for the same thing. Okay. I would also listen to her lungs posteriorly, and her lungs sound pretty clear. What I'm hearing are vesicular sounds mostly throughout her lungs, and bronchial sounds around the trachea and like upper part of the chest. And these both are normal sounds. Should I hear any rhonchi, should I hear any wheezing or crackles, that would be abnormal. Those would be adventitious sounds, and that would definitely mean something abnormal is going on. So next, I'm gonna move to the abdomen assessment. So I'm gonna lift up your shirt, please. So I'm looking at her abdomen, and it is symmetrical. I'm gonna assess the contour. Contour is pretty normal. It looks nice and flat. It's the skin looks normal. I do not see any striae. I do not see any pataches. There's no pulsations, and there is no peristaltic movement. So this is all good. I do not see the Collins sign, which would be ecchymosis midline, and there's no gray Turners, which would be ecchymosis on the flanks. I also am gonna do the check for chest expansion. I'm sorry. So I'm gonna place both of my hands on her chest, like around the xiphoid process, and I'm gonna ask you to breathe. And as my patient's breathing, my hands are expanding equally, which is normal. They rise and fall equally. So everything is symmetrical as it should be. I'm also gonna check for jugular vein expansion, and for that, I'm gonna lower the head of your bed. So I wanna make sure that my patient is supine and she's in flat position. And I'm sorry, I'm gonna remove the pillow for just a few seconds. And I'm gonna stand on my patient's right side. and I see a very light black distension of the jugular vein, which is normal. So now I'm gonna go ahead and raise the head of the bed to 45 degrees. Okay, and I'm looking at your neck, and the distension is completely gone. So that is a negative JVD test. That means everything is within normal limits, as it should be. If she still had, if there was still distension and pulsation present in her jugular veins as the bed is raised to 45 degrees, that would be a positive JVD test and could indicate cardiovascular pathology. So going back to the abdomen. So I already assessed it visually. Now I'm gonna auscultate it. I'm gonna go ahead and auscultate all four quadrants of the abdomen. I'm gonna start with the right lower quadrant. And I do hear bowel sounds. Normal bowel sounds are present. I'm gonna auscultate for 1 full minute in each quadrant. And I wanna make sure that the bowel sounds are present. If I do not hear any bowel sounds, I would actually have to listen for 5 full minutes in each quadrant before I can document that the bowel sounds are absent. Next, I am gonna move on to light palpation. Can you please tell me if you feel any pain? Any pain?
No.
I'm looking for any like superficial tenderness, any lumps of bumps, and there isn't any. Now I'll move on to deeper palpation using both of my hands. Any pain?
No.
And I do not feel any bumps at all, any lumps or anything. So everything looks normal. I would also assess my patient's genitals. I would check for any drainage or like discharge. I would check the general condition of the skin, check for any redness, presence of any like warts or even parasites, any bruising, any like lesions, and none of it is present. I would also assess my patient's stool and urine. So when she went to the bathroom, her urine was clear and yellow in color, and the stool was small, brown in color and formed, which is normal. So now I'm gonna move on to musculoskeletal / neural. And for that, I'm gonna ask you to get up and take a few steps, like around the bed, if you can, please. So by observing my patient walking, I can assess her gait and balance. So my patient gait is normal. I do not see any shuffling, any spasticity, any tics, only tremors, and her steps are normal, and her balance is good. And now next I'm gonna check do the sensation test. So I'm gonna ask you to close your eyes, please. I'm gonna touch you with my pen light. And can you please tell me where you felt it?
My right knee.
Okay, great. So next I'm gonna assess the upper and lower extremities. So they look symmetrical. Lower extremities look symmetrical. I'm gonna palpate for muscle tone and for presence of any edema. I do not feel any edema. Muscle tone is normal and equal bilaterally. I do not see or feel any muscle atrophy. I'm gonna palpate over the joints. Do you feel any pain?
No.
Now, do you feel any pain?
No.
And I do not feel any swelling either. So there's no pain or swelling, which is good. I'm gonna assess for strength in her upper extremities. So can you please squeeze my hands? Okay, push down on my hands. Now pull my hands towards you. Okay, so my patient's strength in her upper extremities is good. I would note that as 5 out of 5. Now I would assess the feet, the lower extremities. Okay, I'm gonna press down on your feet, pull your feet up. Okay, now press down against my hands. Okay, so she's got pretty good strength in her lower extremities, and I would also note that as 5 out of 5. So next I would assess for range of motion. So can you please repeat what I'm doing? So for the shoulder, flexion, raise your hand up like that, and extension, abduction, adduction, circumduction. For the elbow, flexion, extension. For the wrist, flexion, extension, supination, pronation, ulnar deviation, radial deviation. For the fingers, abduction, spread them apart, bring them back together. That's adduction. Opposition is when you're touching your thumb to each of the fingers in your palm, and everything looks good. Now for the hip, also, flexion, extension, abduction, adduction, circumduction. For the knee, flexion, extension. For the ankle, plantar flexion and dorsiflexion, eversion, aversion, and also for the toes, curl your toes up like this for me. That's flexion of the toes, and straighten them out. That's extension, spread your toes apart if you can. That's abduction and adduction. So everything looks good. My patient's range of motion in all of her joints and extremities is very good. Now I'm gonna check for carpal tunnel. So I'm gonna do the Fallon test. Put your hands together like this and hold them for 60 seconds. Do you feel any pain?
No.
Do you feel any numbness or tingling? No? Okay, so that's a negative Fallon's. Now can I see your hand, please? I'm gonna tap on her medial nerve. Do you feel any pain? Any numbness, tingling? So that's also a negative Tilland's test. So that means that she doesn't have any carpal tunnel. Now I'm gonna check for fluid in her knee. So the Bulges test is that when I stroke like the inside, the medial aspect of her knee 3 times, and I do not see any like waves of fluid going over the patella or anything like that. So that's also a negative Bulges test. And the Latman test, I'm gonna depress the suprapatellar notch with one hand, just like that. And tap on her patella with the other hand, and the patella doesn't tap back, so that's also a negative Balatman test, and that means that she doesn't have any fluid in her knees, which is normal. So that would conclude my physical assessment. And Ms. McCurry, here's your call light. I'm gonna go now, come back in 30 minutes to check on you. Do you have any questions for me?
No.
Okay, so I'm gonna lower your bed, and please do not hesitate to use the call light if you need me for anything.
Okay, thank you.
Thank you.